Hi everyone, thanks for joining. We're going to get started now. Today we have approximately 30 minutes, and just a reminder, one question, one follow-up. We have Dr. Williams and Dr. Yaffe here today, so I'll turn it over to them for some brief remarks.
So good afternoon. It's our Monday, so we're giving a data update on what went on over the weekend, how the data is looking, and some optimistic messages that Dr. Yaffe will have for you in that regard. As well, it's the last day of May, and so how are we going to look at going into the week ahead and a number of aspects that are there. So as usual, I'm going to hand things over to Dr. Yaffe to talk about the numbers that we're seeing right now and maybe some of the optimism we have in light of those numbers.
Okay, thank you very much. Good afternoon, everyone. Since the last update that was provided on Thursday, Ontario has reported an additional 4,279 cases of COVID-19. If you break it down, it was 1,273 cases on Friday, 1,057 cases on Saturday, 1,033 cases on Sunday, and today, 916. So this is the first time since March 6th that we have actually recorded a number below 1,000 daily new cases. And it's the lowest daily case count that we've had since mid-February, which is great. Our 7-day average is 1,078 cases, and that is down from 1,775 cases just a week ago. And when we look back at the month of May, Ontario averaged 2,197 daily new cases, which is a significant improvement over April's average, which was 3,782. Sadly, we are reporting an additional 60 deaths since last Thursday's update. This includes 13 COVID-related deaths today, bringing the 7-day average daily death toll to 19, which is the same as we had last week. We do extend our sincerest and deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19, and to everyone mourning the death of a loved one. Hospitalizations and ICU occupancy remain high, but the numbers are steadily improving. Today, there are 731 people in hospital with COVID-19, although this is somewhat underreported as not all the hospitals report on the weekend. The number of people in ICU reported on the Ministries website today is 617. We do know, however, that some of these individuals are Manitobans being cared for in Ontario hospitals. So the number of Ontarians in ICU is 593. In terms of testing, 18,226 tests were processed yesterday with a positivity rate of 4.3%. Our current 7-day average for percent positivity is 4.4%. When we look back over the month of May, the daily average of tests processed was just over 36,000, with an overall percent positivity of 6.4%. So again, going in the right direction. As we see our daily case numbers, rates, and hospitalizations decreasing, our immunizations continue to increase. To date, more than 9 million doses of COVID-19 vaccine have been administered in Ontario. This is a tremendous milestone, and every person vaccinated makes us all a little safer. And starting today, everyone in Ontario who's aged 80 and older is now eligible to book their second shot through the province's booking system. I also have a serious interjurisdictional outbreak that I would like to draw your attention to. A large outbreak of COVID-19 was declared at the Mary River mine site of the Baffinland Iron Mines Corporation in Nunavut in early May. And it involves the variant that was first identified in India, B1617.2. Many public health units in Ontario, as well as other jurisdictions across the country, have reported cases as a result of this. Anyone who has returned to Ontario from that mine since April 30th is considered a high-risk contact based on your potential exposure to COVID-19. While every effort is being made by our local health units to contact and investigate all potential cases, there are concerns that not all the mine workers have been identified, and they may not be aware of their high-risk status. So I'm asking that anyone who has arrived in Ontario from the Mary River mine since April 30th to self-isolate immediately and contact your local public health unit. Before I hand things back over to Dr. Williams, I do want to take a moment to congratulate him on his impending retirement. He has worked tirelessly over these last 16 months, guiding us through this pandemic, and has dedicated his entire career to the service of others. Dr. Williams has shouldered a heavy load, and he has done so with integrity and compassion. I will definitely miss working with him, but his retirement is well-deserved. I look forward to welcoming Dr. Moore and to continue to work to come to the end of this pandemic. And with that, I'll turn it back over to Dr. Williams.
Well, thank you, Dr. Yaffe. It has been a pleasure to work alongside you day in and day out for the past 16 months and a couple of years before that in many work and activities over the years. I look forward to continuing our partnership through to the end of June when I officially retire. It's been an honor to serve the people of Ontario and to guide public health during the worst public health crisis of our generation, probably the biggest one we've had ever. By pulling together, we've made tremendous strides in the battle against COVID-19. That is why I agreed, beyond my initial retirement date in February, as requested and asked by the government, to extend my appointment further and to extend my retirement date to May 30th of this year to ensure a seamless transition. I was asked further to extend into June if I could, to allow the movement through the third wave, and then to look at a date which I then gave notification of that I would be retiring on the 25th of June. And I was really pleased to hear that a successor has been chosen and will go through the appointment process in the legislature in the next few days. So I really am enthused to welcome Dr. Kieran Moore into the position as my replacement. If appointed, I am confident he will do an outstanding job, and I look forward to working with him over the next few weeks during this transition period, as I was looking forward to this very much, to be able to hand over, and with all the staff and resources, others like Dr. Yaffe, Dr. David McEwen and others, Dr. Warshawski, and the team to give support along with all our directors and our whole division to helping Dr. Moore into the job, as well as our whole structure within the Ministry of Health that has been doing a tremendous job over the last 16 months. While I'm looking forward to retirement, there's still work to be done and a pandemic to fight. We are still in the third wave. Our numbers are coming down. We're not yet below where we were as the transition between the second and third wave. We are getting close, and we want to make sure we continue on this path. And the numbers that we alluded to today are most encouraging, as we had predicted, with our vaccination rates continually rising and encouraging everyone to go out and get vaccinated when your first time is ready, and more importantly, when you get notification of your second dose. And so keep at it, Ontario, keep getting vaccinated. The fruits of this endeavor are being shown with our numbers coming down as we seek to relieve the pressure on our hospital systems, as Dr. Yaffe has alluded to. So we have that work ahead of us. So these are encouraging trends. And so I want to thank you for your continuing effort to do the public health measures that you are doing at this time, but to continue to get your doses of vaccine when you are called and when the opportunity arises. It's your best protection, not only for now, throughout the summer and to help things to return to a more normal state for the summer and fall. And that I'm hoping that by the end of June, we can be in a very good position to hand things over to Dr. Moore, who has a whole task ahead of him with the recovery type phase and activities that will be just as challenging as the pandemic. So with that, I'm going to hand things over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Randy Rath, CHCH.
Yeah, hi, doctors. Thanks for taking my question. I'm wondering why you changed your directive on to allow fans into the Leafs game tonight. Could you explain that?
Well, thank you. We were asked about the concept of allowing fans into the hockey game because we are still coming out of the third wave. We still have substantial numbers in the hospitals and cases. We were in discussions not open to have fans in. There was a request that could the government honor the work of healthcare workers by allowing a number of healthcare workers who had obviously been through a lot of hard work over the last while to be representatives of their respective organizations to come with proper infection prevention control aspects in line, including having had 2 doses past 3 weeks. And of course, all these staff are quite well aware of what proper IPAC is and to handle that. And so it was seen to be a good gesture. So with that, along with Toronto Public Health, we agreed that a certain number could be distanced properly and safe, maintaining those extra measures to ensure that, while at the same time representing the healthcare workers who have been putting in a huge amount of work and hours to say thank you for what you've done, and perhaps they can encourage the home team to do a good job this coming night and to do well in that. So we said that would be reasonable, and with Toronto Public Health, with those measures in place, it would be safe, and knowing that they are experts at handling infection prevention control and have been doing so steadfastly over the last year and a half and much more intensely in the last 4 to 5 months. So thank you for those who get the opportunity to go and for representing those who may not be able to go. Fantastic job that you have done and that you are going to be doing, and we really want to honor you that way. So thank you.
Follow-up?
Yeah, thanks. So it means that it's not indicative of other sports facilities allowing fans in anytime soon, I take it. My next question is, last week we saw Western University say that they would, if you wanted to stay in their residence, that you had to have proof of vaccination and be fully vaccinated. We've seen the mandate come out for long-term care homes today from the Ministries saying that, if you want to work in a long-term care home, you have to have proof of vaccination or you have to take a course, which gives you an understanding of why you need to be vaccinated. Does that make sense? Are we going to see more things, more events, more jobs where people are excluded if they haven't been fully vaccinated? I know that you can't demand someone be vaccinated, but does it make sense that you can exclude people that haven't been vaccinated from certain activities?
I think over to Dr. Yaffe.
Yeah, thank you for that question. Certainly, I'll start by talking about the long-term care. They are going to be requiring every long-term care home to have a policy regarding immunization for their workers that will take effect, I believe, July 1st. And it will give them a choice. The choice is show proof that you've been immunized for COVID-19, show proof from a medical doctor or nurse practitioner that you have a valid medical exemption, a medical reason why you cannot get the vaccine, or you take an educational course which will go through the benefits and information about the vaccine. And they will then keep the documentation. And this kind of policy, I believe, is based on policy that's used in some hospitals. And it's a good idea. It certainly makes sure that people have the information to make an informed decision. Part of it will be making sure that people have access to the vaccine if they haven't already, make it easy for them to get the vaccine. And I believe as well with the Western University policy, as I heard it on the news this morning, part of it will be to make sure that people are able to access the vaccine. It's important to know about it, to know the benefits and potential risks, but also to be able to get it quickly and easily if you want it, and then to have that information. I think it will help a lot with the residents in particular, because if there is a case, first of all, there'll be a lot less risk of the transmission because people are immunized. And also there'll be much better records about who's immunized and who isn't in terms of measures that will need to be taken. So I see that there is potential for this kind of thing being used in other settings. I know there's a lot of interest. I think part of it is in terms of employees, you cannot require somebody to be vaccinated unless it's a condition of hire, as I understand. But you can require them to provide proof if the policy of the institution is that they have a choice: vaccinate, exemption, education. So yes, I see this as a very positive trend. We'll have to see how it goes we were talking about, should this become a requirement for school children, for example. Right now, the vaccine is not licensed for children under the age of 12, and the actual schedule going forward is still to be determined, but I can see certainly potential in the future for that.
Next question.
Dave Woodard, Global News.
Good afternoon. I do want to follow up on the vaccination mandate. Dr. Yaffe, do you think that other ministries like the Ministry of Health or Ministry of Education should adopt the same type of mandate? And without a vaccine passport, how is that going to be monitored?
Well, I think the issue of a vaccine passport is, it's being discussed, I believe, at the federal level, because it certainly comes into play in many settings, particularly at the border with travelers. Certainly right now, I think the focus long-term care is because right now, as you know, the almost 100% of residents are fully immunized. The percentage of staff that are immunized varies around 70-75% as an average, but there are some homes with very low coverage rates. So I think this is a good move to say, we need to really focus on making sure that the workers have the option to get immunized or get education or get a medical exemption, and then have good records. So if there's an outbreak in those settings, it's a congregate setting of a very vulnerable population. So whether that's something that needs to be expanded to other settings is up for discussion still.
Follow-up.
Thank you. And Dr. Williams, I want to say thank you for heading up public health, especially over the past 15 months. We all know that it's been a very trying time. But is there anything that you look back on over the last year and a bit and think that you would have liked to have changed or spoken out about before you did?
Well, thank you for your compliments. And as I said before, it's been an honor to serve the people of Ontario, as well as to work with the huge amount of staff and inputs from various experts all the time. And I can really confidently say that each time we made decisions based on the best evidence we had, not just of my perspective, that was never the case, of looking at input from experts, Dr. Yaffe, and others as well, to science tables, PHO, all through the ministry, different areas. And that's been the point we've done for that time. So I think the decisions, I really believe at the time, were the best ones we made with the evidence we had. So I think reviews and things will say if there's any system things we could look at, let's look at those and see what we can do. But it's been a full effort by everyone coming in and weighing in with their best advice at the best time and moving on that and directing that accordingly. So thank you again for your comments and for the privilege of serving Ontario in this way over the last 16 months. As you said, it's been steady and solid through the whole time, and but we have a great team and I think a good successor coming in.
Next question.
Colin Cote, Radio Canada.
Hi, my question is regarding the Porcupine Health Unit. I was wondering if you guys had maybe other recommendations or additional recommendations for this health unit? Because we know it's pretty tough for that region right now, and the other regions surrounding it are having it. It's better for them. So, yeah, I was just wondering if you had any more recommendations for them.
I'll start, and maybe Dr. Yaffe wants to add some more comments. We have been in consultation with Dr. Catton and the team there. We've been supporting as best we can with our central case contact management people, adding more vaccines into the mix, and they are progressing in that. With some of the data that flows into the Porcupine Health Unit, it comes from other communities, and they have a wide geographical area all the way up to James Bay, which includes Moose Factory, and some of the communities on the James Bay coast. So those numbers also feed in, and we've been working with those organizations, as well as our federal counterparts, as well as health authorities in those regions to undertake as best we can to help and service that. We are starting our second phase of remote immunity with teams going up to various communities to start the vaccination of the First Nation youth, 13 to 17, and to see if anyone else who missed the first round and second round would get covered on that. So there's a number of aspects we're carrying out there and trying to assist the medical officer of health there, whatever she would like to have, and we're in continual conversation. I'm not sure if Dr. Yaffe has any further comments, who is in contact with Dr. Catton on a regular basis.
Yeah, thanks. I certainly have had multiple contacts with Dr. Catton, who's the medical officer of health in Porcupine, and we are working very closely, offering assistance, as Dr. Williams said, with case and contact management. As well, through Public Health Ontario, we're offering support around things like data entry and epidemiological analysis of the outbreak. Certainly making sure that they have vaccines so they can make sure people are offered vaccination. And also working with her around the necessity for isolation centers. I believe 2 of the jurisdictions in our health unit have declared emergencies, state of emergency, which facilitates setting up isolation centers, and then the staffing of those centers. So in a way, Porcupine is experiencing something similar to what Thunder Bay had not so long ago. She's been in contact as well with Dr. DeMille, who's the medical officer of health in Thunder Bay. So learning from each other and working with us and getting support. It's a difficult situation right now, but we'll get through it.
Follow-up?
My other question, any recommendations for, the gap between the end of the stay-at-home order and the beginning of the phase 1 of the reopening plan, hopefully on June 14th? Any recommendations? And also, because Dr. Yaffe, you spoke about that mine in Nunavut, do you think that there are some cases related to that mine with Northern Ontario? There are a lot of mining workers up there,
Two-part question. I'll answer the one on the gap and hand things over to Dr. Yaffe for the mine outbreak. So as you noted, when the stay-at-home order is to be lifted under the EMCPA, the Emergency Management and Community and Civil Protection Act, some of those regulations will stay in place. Some will be lifted in there, but then the emergency brake situation is still in there, which is like the old gray zone, if you may, prior to the new framework coming into phase that we're looking at somewhere in the week of aiming to go the week of the 14th of June. So we still have lots of things we've recommended in there, as we've already put out in that phase, with the outdoor activity being emphasized, still limiting to households, staying home when you can in those activities there, limiting and wearing masking and distancing when you're in congregate settings. So we have some things in place there, and we'll be outlining those in more detail in the days coming up as we go through the process. So while there's a step back in some things are still in order. And our main message is stay the task. Our numbers are coming down really well as people are getting their vaccine, first dose and second dose, and allowing the immune system to pick up in those 3 weeks after your dose. But you still have to do the measures of protection that are in place at this time until we progress further in our vaccination program. But thank you. Everybody's doing really well with, and often many days, over 120, 30,000 vaccines being delivered, even on the weekends. So terrific work by public and by all those individuals who are doing those vaccine centers. That's a lot of work being done diligently, careful monitoring. And so thank you, everybody, for doing a fantastic job.
With respect to the second question around the mine outbreak, we know that there are approximately 1,000 workers at that mine. And according to the chief MOH for Nunavut, over 120 cases that were definitely identified, most of them on site. But about 300 of the workers come from Ontario. And it's a site where it's a fly-in site. So people go in for a few weeks, then they go back home, then they come back, and so on. And so we are aware of a small number of cases already that have occurred in those workers that have returned to Ontario. But what's really key is obviously to get the outbreak under control at the mine, but also to make sure that those workers who were at the mine, who are now in Ontario, are informed, if they already don't know, informed that they may have been exposed. They should be isolating, they should be tested. And we have a list that was sent to us from Nunavut. We have had a call with all the health units late last Friday. We were aware of workers that had come back to 33 of the 34 public health units, so it's pretty much the whole province. They were following up with them over the weekend, and we'll be getting an update from them in the next day or two.
Last question.
Laura Stone, Globe and Mail.
Hi, Dr. Williams. Congratulations on your retirement. I'm sure you'll miss us. I wanted to clarify something you said earlier. I thought your term was supposed to go until September, but you mentioned you were retiring at the end of May. So what exactly went on there? Did the government ask you to retire early so that they could bring in Dr. Moore? Are you able to clarify? Thank you.
My position at the time when I was asked to extend beyond the 16th of February 2021, that I would do so, endeavoring to retire at the end of May, knowing that they might continue to have the order in council continue that gives adequate coverage, that if someone like Dr. Yaffe wanted to act in my position, they could act up in that position so that it wasn't left vacant and to allow adequate time for recruitment to occur. So that was the setting. And then in May, as the third wave continued, I was asked by my deputy to say, would I consider staying on further into June? I said I would, but I did give notification in May that my last day would be June the 25th. And now I'm very pleased that a successor is in the process of being appointed. So I'm looking very much forward to that.
Follow up, and this is the last question.
Okay, thank you. And I was wondering if you could comment just on the decision-making process that we're seeing around schools. The Premier has been adamant during your time that there's no light between yourself and him. He always listens to you, and you've been saying for quite some time now that you think schools are safe and should return, but that hasn't been the announcement yet from the government. So what is your understanding of why they haven't moved on a school announcement yet?
So, yeah, thank you. I was asked for my input before. Do I think schools are safe to open? From my perspective and from those from our medical officers of health, and we did ascertain, with the exception of Porcupine at the moment because of the big outbreak they're in, they felt confident at this stage because the number of cases, as we've talked about today, have come down extensively enough that the case contact management is robust in such a level that they can maintain the previous safety of schools on a go-forward basis. At the same time, as I said before, I was aware that there's a number of groups that come into this decision-making. Mine is a recommendation, goes to the Minister of Education. You have the Ministry of Education, you have the boards of education, you have the various staff and that, and parents and different groups that play into this. So, as always, I make my recommendations to my minister and to the Premier indirectly in that, and then it's really a decision of the government if and when they're going to undertake that. And I understand that's being reviewed at this time, and we'll be waiting for a decision in the next number of days.
Thanks, everyone.